Resources is important. Notwithstanding the present state of our economy and the unavailability of resources, I announced a $4.5 billion allocation to assist in our COVID response. In addition, we are in the process of mobilizing approximately $60 million from the World Bank, OFID, IDB, and the Islamic Development Bank. This is in addition to the $2 million grant received from the government of India. These are outside other bilateral support we have received and are in the process of receiving. To tackle the ongoing challenges, the Minister of Health has advised that a number of interventions have been made to improve test turnaround time, testing capability, human resource capacity, infrastructure, and equipment. To this effect, the government has been able to move to a situation from which we had less than 10,000 N95 masks in the system 2 weeks ago to a current situation where we have approximately 65,000 N95 masks available and an additional 25,000 in order. Testing has moved from a position of 40 to 60 per day to 96 to 140 per day. Notwithstanding a significant improvement, there is a backlog of 700 test results. This is as a result of the manual PCR machines currently used and also the lack of medical technologists. 2 weeks ago, we had one medical technologist working. By the end of this week, 30 new medical technologists will be trained in PCR testing from both the public and private sector and will be available from next week. In addition to this, 2 new automatic machines will be sourced to cut testing turnaround time from 9 hours to 2 hours. This will not only clear the backlog, but significantly improve our capacity to do mass testing, which will become necessary in the eventual opening up of our economy and country. Additionally, we currently have 4 working ventilators at the Georgetown Public Hospital Corporation. By next week, 29 additional ventilators will be in the country to be utilized not only at GPHC, but in all the regions of our country. The ministry has also advised that additional healthcare personnel, including doctors, has been deployed to hotspot areas in Regions 7 and 9. Further, in dealing with the issues of isolation, the ministry would convert the inoperable infectious disease center to an isolation facility. To this end, arrangements are being made to have a facility that caters for 150 patients requiring isolation. I've directed Minister Manichan to develop a plan to address the delivery of education to our children in a COVID-19 environment. After consultation with various stakeholders, it was decided that schools were not in a position from a public health, infrastructure, and facilities standpoint to facilitate a reopening in September. The minister has been asked to implement a comprehensive plan aimed at ensuring children and teachers remain engaged in learning. Whilst we'll make available $500 million to equip schools and provide COVID-19 support services and facilities for our children and teachers, the ultimate goal is to have our schools in a state of readiness at the earliest. In the interim, the ministry has been tasked to put the infrastructure in place for the delivery of the curriculum via the Learning Channel, state radio broadcasting, and privately owned media houses. While being a global health risk, COVID-19 poses serious financial threats. In our continued efforts to safeguard and strengthen the resilience of the sector, I've advised the Bank of Guyana to examine a number of measures. The governor has since advised me that in consultation with the Guyana Bankers Association, the following agreement has been met. The Bank of Guyana will extend the moratorium to December 2020 to allow banks to further defer customer payments to the end of December 2020 to cope with the low revenue generation needs to meet operational needs. This accommodation will result in loans not being classified as non-performing and hence will not require loan loss provisioning. The Bank of Guyana will relax Section 14 and 15 of the Supervision Guidelines, number 5, to December 2020. Additionally, a waiver is being given to Section 13 of Supervision Guideline number 5. The relaxation of stringent statutory measures is intended to result in direct benefits to customers of banks by giving the financial institutions the ability to operate with more flexibility. The Bank of Guyana will reduce liquidity requirements in two areas: lowering of the reserves requirement from 12% to 10%, lowering the liquid asset requirements for demand and deposit from 25% to 20%, and saving and time deposit from 10 to 15%. These measures will result in overall increased liquidity in the financial sector. The reduction in reserve requirement will result in injection of $9.4 billion, and the reduction in the liquid asset requirements will immediately release an estimated $23.3 billion in the economy.